Like many things in life, you don't really know what you're getting into until you're in it. This can definitely be applied to my experience and my development of my philosophy of practice. I would unequivocally say that I had no idea what I was getting into when enrolling in this program. In the beginning of this program, I would have considered my approach to be more of a sophist approach. Find a solution to a problem, fix it, make something better. As with all experiences and growth, my ideas have changed. This change in me happened while I began researching topics on gender differences and confidence. I wanted to understand why it's different for females compared to males. As a girls softball coach for over 10 years, I was consistently present during self-defeating moments and self-deprecating out loud self-talk. It has become a passion of mine to work with youth female athletes to develop and build stronger foundations of confidence within themselves and their abilities. So, more and more, we are seeing a trend where young athletes are being asked to train like elite athletes. The demands and pressures are high. The most vulnerable of these athletes are females. According to the U.S. Department of Health and Human Services, the depression prevalence rate for young adults is higher than that of any other age group. And as you can see from my graph, female athletes are 2 times more likely to experience symptoms. While my current goal will not be working with elite or collegiate athletes or be involved in clinical work in this regard, I'm very passionate about creating a sports confidence and resiliency program to begin to address the demands and pressures placed on these youth female athletes. And ideally, I'd like to work with individual athletes, coaches, and even club organization directors. Since my goal is to work with the population of female athletes, I feel the best guidelines, and something that I also truly believe in for my practice, will come from the humanistic perspective, Maslow's hierarchy of needs theory, Erik Erikson's stages of development, and more from a Socratic method. I realize this doesn't cover a broad spectrum of athletes or performers, but I feel like at this time in my development, having a more specialized program will actually benefit me in terms of marketing. So many parents in my area are willing to do anything for their children and their ability to perform at a higher level. And I'm currently developing a program that will be marketed to club teams in the Bay Area. It's a 3-day program lasting from like half an hour to an hour, where it's primarily focused on sports confidence. The goal will be to educate players and to strengthen their state confidence. Taking a humanistic approach for this age group really does seem appropriate. Knowing that this age group is seeking really a sense of autonomy and a sense of personal identity, it'll be important for me to create an environment that really encapsulates what the humanistic approach is about. And this is, creating an environment which is genuine, it's a feeling of acceptance, and it's empathetic. I personally feel that this is a delicate time in a teenager's growth development. Erikson believed that this stage was the stage of identity as well as role confusion. So they, excuse me, are in the process of developing their sense of identity, their values, beliefs, and goals, while really also trying very hard to fit into society roles. And so I see my role as someone who is navigating them through this process, through the principles of humanism, just really seeing all of them, not just the identity of the performer. And when I was researching the humanistic approach, I came across this great quote, given the right environment, we will become the best that we possibly can be. So, learning from my experience, at my last internship, I had the opportunity to experience what happens when you don't come from a place of exploration. I worked with a girl who we will call Leslie. Leslie was a 16-year-old high school lacrosse player who played a significant but more of a supporting role on the team. During the season, she came to see me and discussed how difficult it was to play with 2 players she felt got most of the attention and most of the playing time. Additionally, she was concerned that she was having a hard time with her ability to pass the ball, something many of the players had discussed during our sessions. I know that I explored to some degree her emotional experiences around the players receiving most of the attention, excuse me, but because she immediately determined that she could change her attitude and her mindset about the situation, I just backed off and went directly to a solution, a more sophist approach to her ball passing problems. At the end of a disastrous season for the team, her mother set up an appointment with the athletic director and the head coach. She was very distressed about playing on the team, and she was having a lot of difficulties with the coaches. So, as it turned out, she actually was having a very hard time with one of the coaches, the male coach, who she felt wasn't giving her enough attention and appraisal. Also, she was still struggling with the dynamic of the two players who got most of the attention. So, had I taken a more Socratic approach to our work together and really had considered Maslow's hierarchy of needs, I think this would have made me consider her need for belonging and recognition from both the coach and her teammates a little bit more. And I may have considered her words more carefully. This is why I will definitely add a reflection practice to my work. Looking back and seeing where I could have done something differently is important for my growth and development. I think for this population, really a semi-structured assessment that contains relationship status with teammates, coaches, friends, and families will be more advantageous to my understanding of the player. By utilizing the concepts of a Socratic approach, I can really begin to explore more in-depth information about what's probably the most significant aspect of their lives, which is their relationships. And I've also thought that using the Briggs and Myers personality test would be helpful in understanding how my client perceives the world. So one thing I learned, well, one of the many things I learned during my internship is to keep it simple. And I think the 4 intervention practices I will be most inclined to look out for in terms of guidance are Bandura's self-efficacy theory, self-determination theory, cognitive evaluation theory, and mindfulness-based practices. So what I like about Bandura's self-efficacy theory is that it has a lot of practical applications for someone to gain perspective on their abilities. If you outline their successes, there is practical information to help an individual see their own capabilities. And additionally, they have found evidence that goal setting helps with self-regulation. So this is very impactful for an age group who are more driven by emotions than critical thinking. And there is a growing body of evidence of the positive effects of verbal persuasion, also known as self-talk. One study found that the most effective way to use self-talk was to focus on task-specific language versus motivational language, really enabling the girls to focus on task-specific requirements could eliminate the negative self-talk that can be defeating. So what studies have shown us is that the more practice individuals receive in developing and strengthening self-determination skills, the more likely they are to make better decisions. Opportunities to practice skills that support self-determination also lead to greater independence and self-advocacy. Here's where the value of goal setting really comes into play, by determining why the sport is so important to them, by setting goals where they can see their own successes through their work ethic, and knowing what's realistic really enables them to see the reality of what it takes, what choices and sacrifices they need to make. And that just really gives them a greater sense of competency in their abilities, knowing that they can endure pretty much anything. So honestly, while I strongly believe in the interventions of self-talk, goal setting, and other techniques which contribute to self-confidence and motivation, I think my practice will be weighted towards the use of mindfulness, emotional control. While there is evidence to support its benefits, for example, in a 2010 study on mindfulness-based stress reduction programs, there was definitely a strong correlation between the practice of mindfulness techniques and the reductions in symptoms of anxiety, depression, rumination, which is huge for this age group, state anxiety, and increased self-esteem. While I see all the benefits that, I also recognize that there is still some skepticism about its effectiveness. And, I know that the population I'll be working with might not be as open-minded, but throughout the readings and expert approaches, the authors continually discuss the importance of self-awareness. So to me, knowing what happens before, during, and after a performance is critical to recognizing and changing patterns that contribute to performance breakdowns. So again, I'll refer back to my experience with the internship I had this last winter quarter. Many dynamics played out. Lack of role clarity, lack of expectations, no team meetings, some team bonding, divisions within the team because one player was more vocal and more dominant. But it seemed like the highlight of issues came from the lack of communication. Communications. So individuals were willing to discuss with me the problems they were dealing with, but almost stoically and unwillingly, they were they didn't want to talk to their teammates or their coaches. And so that is something that I find to be a missing piece within team chemistry, and something that it will be most impactful in my work with teams. I still think for individuals, I still think the most valuable knowledge is to understand why someone loves to do what they do, and um, what sense of competency it gives them. And, understanding the demands that are placed on the athlete and how they perceive these demands will obviously be more of the cognitive evaluation, where they're just really seeing like what they can thrive in and what they can't. So, what do I believe? It was so interesting to read most of the expert approaches to their practices, because it became apparent that after many years of experience, many described how their practices evolved from very specific ideology to more of an intuitive, client-centered approach with a great appreciation for the complexities of human nature. And something that I've come to understand is that there will not be a perfect answer or a perfect solution, but if we are guided by our principles of not harming, caring for others' well-being, and most importantly, bringing our authentic selves, we can really truly accomplish a great deal. That's it for my presentation, and thank you for listening.